Hola, buenas tardes. Todavía vamos un poco retrasados porque la sesión no ha terminado. Solo pedimos para aguardar un poco porque las delegaciones todavía siguen en la sala A. Gracias.
Check 1, 2. Check 1, 2.
Buenas tardes. Buenas tardes. Solo para recordar.
Good afternoon. I'd like to remind you that the table chairs are for the heads of delegation and ministers. Thank you.
Ahora sí.
Cinco minutos. Hola. Trabajando para el doctor. Buenas tardes. So, seguir el programa. Yeah. Good afternoon. Good afternoon. Hello, hello. Can I have it? Good afternoon. Buenas tardes. Can I please ask you to take your seats? Main rows for the delegates and jefes, chief of delegations. Más? I'm going to eat it. So that's my sandwich. Okay. If we can all sit so we get started, because the timing of the director is limited and we wanted to take advantage of him here. So thank you all for coming. I'm going to start. My name is Marcos Espinal. I'm the Assistant Director of PAHO, and I'm going to be your moderator. I'm going to be strict with timing, and so we are all able to take the program on board. We have an exciting program today, and hopefully you enjoy and you also are able to contribute. Is that okay? Is there translation? No? It's working? Okay. So the session today, it's titled Ending Communicable Diseases in the Americas, Accelerating the Elimination Initiative. This initiative started in 2019 with the approval by the Directing Council of the Pan American Health Organization of a policy for an integrated and sustainable approach to communicable diseases in the Americas. It was known as Elimination Initiative. But as you know, COVID-19 pandemic really changed everything, and many of our priority programs and many of diseases that were under control went backwards and went really suffer a lot, and they needed to be relying in not only in solidarity and Pan-Americanism, but also in sisters and brothers programs and so on. And the devastation caused by the COVID pandemic really set backwards some of the hopefully Millennium Development Goals to achieve, and many of these diseases needed to be prioritized. So the new administration of Dr. Barbosa has decided to reposition and relaunch the Elimination Initiative, and this is what you're going to be able to see today. La sesión cuenta, paso a...
Let me switch to Spanish. You have the programs.
en las pantallas.
The program for the session is on the screen, but you also have it before you. And we're first going to hear some opening remarks from the director, then we'll be watching a video, followed by a presentation by Dr. Massimo Gidinelli, senior consultant who has been working on elimination. Then we'll have a ministerial panel with the honorable ministers of Antigua and Barbuda, Uruguay, and the representative of the TB control program from representing the Minister of Health of Brazil, Nícia Trinidade, who unfortunately could not join us today. Then we will have a presentation from our regional revolving funds, and this is a presentation that will be given by Mr. Santiago Cornejo. So without further ado, welcome to you all. It's a pleasure to have you. Enjoy your lunch. And with that, I'd like to offer the floor to Dr. Barbosa for his opening remarks, thanking him for his presence here. Dr. Barbosa, please. Thank you, Marcos.
Welcome to this briefing session on the Elimination Initiative. Upon my election as PAHO Director, I committed to pursue 5 priorities to achieve my vision of advancing towards universal health in the Americas, including an uncompromised support to the Disease Elimination Initiative, which was launched in 2019, but shortly thereafter was heavily impacted by the COVID-19 pandemic. I am convinced that the region of the Americas is in a unique position to take the response to eliminating communicable diseases and related conditions to a new high, and that includes the elimination of as many as 30 of them by 2030. As we gather today to celebrate the reposition of the Elimination Initiative in the post-pandemic phase, I'd like to share with you 3 solid arguments that corroborate the attainability of the elimination goal. The antecedents of the region in dealing with communicable diseases and the rich palmares of achievements indicated that member states have both the capacity and the experience to achieve such an ambitious goal. The documented ability of our health systems to rapidly save and integrate the opportunities provided by strategic innovations and technological advances. In the lessons learned throughout the pandemic response to and the focus on building resilient health systems of the post-pandemic phase are converging in this direction. As we move forward in the pandemic recovery, it's time to give the Elimination Initiative a renewed, stronger, and more mature push to complete a goal on communicable diseases that started right at the establishment of the organization 120 years ago. The know-how from previous experiences in eliminating communicable diseases, the robust armamentarium of vaccines, diagnosis, medicines, and other technologies available, and new ones soon to be ready for deployment, through the regional revolving funds, the deep understanding of health inequities and the clarity to focus on populations in situations of vulnerability, as experienced during the pandemic, have led the repositioning of the Elimination Initiative with its new 30-plus visual identity. The Elimination Initiative holds the potential of a key driver to health system strengthening and resilience, as well as to pandemic preparedness. It's time to take to fruition the efforts and the investment of the last decades on disease control programs. Let's raise the bar and set the ambitious goals and objectives of disease elimination for the entire region of the Americas. At the same time, I would like to emphasize that achieving such an extraordinary public good requires serious efforts in addressing health inequities and focusing actions on populations in situations of vulnerability. Our vision, is not taking shape in isolation. Many encouraging signs in global health and partnership building are pointing in our direction. In today's brief session, we will hear how the region is reshaping its public health horizon, and I'd like to welcome and thank the Honorable Ministers of Antigua and Barbuda, Belize, Brazil, and Uruguay for their leadership and for sharing with us their perspectives and experiences. I would also like to recognize the presence of key partners with whom PAHO is forging strategic alliances towards the common goal of disease elimination, namely Philippe Doneton, UNITAID Executive Director, and the President of the Bill and Melinda Gates Foundation, Gargi Ghosh. Thanks for being with us and for committing your vital support to the region. To sustain the vision behind the 5 priorities of my mandate, I have restructured PAHO to make the organization fit for the challenges ahead. The social and environment determinants for health equity is a new department to drive action on social and environmental determinants of health, on inequities and population in situations of vulnerability. The innovation, access to medicines and health technologies is a new department to accelerate the introduction of new medicines, diagnostics, and other tools in support of elimination efforts. There is an imperative need to introduce multi-platform diagnostics and other new tools that are coming out quickly, in particular at the point of care. The strategic and revolving funds are now fully integrated to be more responsive to the needs and necessities of our member states in accessing vaccines and strategic health commodities. The Department of Health Systems and Services is refocused on its core functions on primary health care and the quest for resilient and sustainable health systems. And finally, the Department of Communicable Diseases that I led some years ago is now fully dedicated to the elimination of communicable diseases. The last step to successfully complete the reposition of the Elimination Initiative is to seek your commitment to engage in this new undertaking, one that, together with the other priority cooperative initiative on integrating non-communicable diseases into primary health care, could profoundly reorient national health plans along new and sustainable perspectives. Let me thank you all for joining us today, and I am confident that the program of this briefing session will prove both inspirational and stimulating. Thank you all. Let's have a very good technical briefing.
It's a new technology, yeah. So, muchas gracias.
Thank you very much, Dr. Barbosa. 2 things before we move on. There is still room at the main table for heads of delegation or ministers. There are no country names indicated. That way you can be seated anywhere around the table. We're also grateful for the presence of the important partners for this elimination initiative, such as the task force from Global Health or Bill and Melinda Gates Foundation, UNITAID, and others who are in this room. So thank you very much. We're now going to watch a video on the Elimination Initiative, and I believe that we are ready to watch it. Thank you.
Hay mucho por ver aquí. Se ha trabajado mucho por generar un impulso en el incremento de la calidad de vida de las personas.
En un mundo con menos enfermedades transmisibles, más personas tienen la oportunidad de construir vidas mejores, más saludables y seguras. Pero el impulso no puede detenerse aquí.
La pandemia de COVID-19 nos ha demostrado que mientras las enfermedades transmisibles sigan propagándose, nuestra calidad de vida está en peligro. Todos estamos en riesgo hasta que estemos seguros.
Por eso, la iniciativa de eliminación de la OPS se ha propuesto eliminar más de 30 enfermedades transmisibles y afecciones relacionadas para el 2030.
Para lograrlo, debemos asegurarnos de que todos en las Américas tengan acceso a vacunas y atención médica de calidad, que incluya diagnóstico y tratamiento oportunos, instalaciones de higiene, agua y saneamiento.
Esto no es un sueño, es un derecho y una responsabilidad de todos. Todos deberíamos tener igualdad de oportunidades para disfrutar de una vida saludable y plena. Hay mucho por ver aquí. Trabajemos juntos por un futuro libre de enfermedades para todos.
Thank you. You know, Dr. Barbosa set the tone, so now let's hear the nitty-gritties or the details of the Elimination Initiative that will be delivered by Dr. Massimo Ghidinelli, former director of the Communicable Diseases Department also, and now a consultant fully dedicated to elimination. Massimo, the floor is yours. Thank you.
Thank you very much. Good afternoon. Buenas tardes a todas y todos. Tengo la presentación, pero era para empezar un poco a ubicar.
Let me begin by describing the history of the elimination of communicable diseases in the Americas. We could say it started 120 years when this public health agency was established. And one of the main functions has been to, when it was established, was to combat two diseases that prevailed at the time, yellow fever and malaria, particularly in the area where the Panama Canal was being built. So over the years and decades, the region of the Americas has distinguished itself for two reasons. First, it has always has a position, as many experts say, as a living laboratory, a very active laboratory, doing experiments and innovation in combating communicable diseases, which has led to a very rich history, many accomplishments, and it has put the Americas region in a leadership position as we work towards elimination. Dr. Espinal already mentioned the documents that were approved in 2019 at the Directing Council that establish a commitment on the part of member countries to introduce elimination in their health planning programs, and also it asked PAHO to continue the implementation of this initiative by providing technical cooperation. He also reminded us that just a few months after the resolution was approved, the COVID pandemic struck and had the impact we all know about in health. I won't mention the statistics because we're all familiar with them, but the outcome was a completely new scenario and context, which made it mandatory to undertake an in-depth reflection and assessment on the part of the organization on the conceptual view. We did this, and the outcome was published in April 22 in the Lancet. Immediately following that, we convened a meeting of the Strategic Technical Committee that supports this initiative of elimination. It's a very high-level committee, and the committee made a series of recommendations to make operational this elimination initiative. Then new management came in with all the momentum and support and considered the initiative one of the priorities of the new management. So then we moved on to positioning ourselves, repositioning it. Here I'm going to describe how we have repositioned this and what is happening with the initiative. First, we reviewed the list of candidates as part of a dynamic process. We eliminated some of the candidates for elimination because they didn't comply with the requirements, and then we introduced new candidates. We, for instance, have drawn attention to bacterial epidemic meningitis, which is now included in the list. Again, thanks to a global campaign for elimination, which was promoted by the WHO. That was the slide that I was supposed to have been showing. So the second repositioning phase, post-pandemic, was what you already saw. So now we have a new visual identity for it, which is made visual through the 30+ symbol, which summarizes the timeline for the initiative to end in 2030. And it includes all the frameworks and global initiatives that will be taken and the number of diseases that are expected to be eliminated by that time, whether more than 30. We have several products we have prepared. You just saw the video. We also have a brochure. And we wanted to make this more visible in social media. So I'd like to invite you to see the completely changed web page. One of the areas we focused on is interdepartmental cooperation. And this initiative, this elimination initiative, is completely looked at by the primary health care department, and the Department on the Elimination of Diseases has several tours available to it. I'd like to mention the operational global framework that was presented as the Astana Historic Meeting in 2018, and which has been adapted, taking into account several of the experiences from the original elimination policy during its preliminary implementation. I'd like to mention the inclusion of HIV/AIDS and prenatal care, which has led to the elimination of mother-to-child transmission of HIV. I'd also like to highlight the integration of the Chagas services and also
VPH e della eliminazione del cáncer cervicale.
the elimination of cervical cancer, neglected diseases. And as a result, we adopted this global framework, this regional context, and we've developed a series of tools, a toolkit with documents that includes all the reference documents which PAHO shares member states. Following the 3I principles: investment, innovation, and implementation, flexible implementation, keeping an eye on the sub-regional level, even at the level of municipalities, districts, etc. Another significant point forward has been innovation. Here, as Dr. Barbosa mentioned it, we have set up a new department that covers all aspects of innovation. In this initiative, Elimination Initiative, it includes three main targets: the service delivery model, based extensively on the experience we acquired during the pandemic. It has several services that are either implemented or led by communities. Another thing is the self-testing, of samples for diagnostic purposes in laboratories. Another aspect of this is digital health and telemedicine. Axis number 2 is information systems and surveillance, with the expanded capacity for greater integration and interoperability of the systems based on the massive use of unique person-centered identifiers. I also would like to point out the successful multiplex platform, which allows for integrated serological surveillance of communicable diseases. This is an option that is increasing, is leading to very many promising outcomes. The third axis is the integrated and modernized laboratory services. And here I'd like to highlight the work we're doing with several partners here in the room, working towards developing a proposal for a multi-country regional project that would encourage primary health care, particularly at the point of care, and with the integrated diagnostic platforms. I don't want to speak too much about the revolving funds, which is the executive arm of all this innovation and availability, but in anything that refers to supplies, it plays three main roles. Santiago Cornejo will talk a bit more about this and give you concrete examples. But in the area of accessibility to supplies with negotiated prices and guaranteed quality. In the area of technical cooperation and the promotion of the supply chain and promotion of innovation, and the whole area of solidarity, which became very important during the pandemic because of this unique Pan-Americanism nature of the organization. I'd like to refer briefly now to the equity and the inequities that exist, the vulnerability of populations, those who are most affected by these communicable diseases. Again, we have a new department here, which has just been set up under the new management, which is the depository of all the work culture that has been created within PAHO and the region over the past decades on the topic of inequity. The tools available are Innovate, which is a global tool, very important. It's been adapted using our region's experience, and also the platform for an intercultural dialogue, which is very important when discussing health matters with populations that need cultural mediation. Also, we need to keep in mind the climate crisis, and these are some, including some of the items that have to be eliminated, are those that are health issues based on the environment. Now we have the progress report that will be presented tomorrow to the Governing Council. We've also just published a guideline for country sheets that take into account all the diseases that should be eliminated in each country. And finally, we have what we call a monitoring framework that tracks the individual progress of each disease. It gives you the approximate dates of expected elimination, and we have therefore a very innovative and interesting framework. I'd like to continue with a look forward to see what are the next steps of this initiative. We'd like to continue with our work on advocacy because we want to mobilize and generate a high-level political commitment, which is indispensable if we're to move forward. We also want to continue creating public-private cooperation, focusing strongly on community participation and the participation of civil society and the social networks from the region, which are still well-equipped but still don't have this very specific focus. We also want to focus on training human resources, including the collaborative centers and the virtual campus, which has been very effective throughout the pandemic. We want to continue our ongoing dialogue with pioneering countries in the region, and we'll be hearing them speak during the ministerial panel. There are many countries that are moving strongly in this direction, and so we want to continue our dialogue with them. We also have a line of work that involves country visits with integrated missions, and we have some countries that have already been selected to receive this visit. And finally, we are working on partnerships with champion countries and strategic partners to obtain the necessary financial resources. I thank you for your attention, and I leave you with our new visual identity. Thank you.
Thank you, Massimo, for telling us about the way forward and the details about how to take the Elimination Initiative in the future, in the next several years. Remember, 2030 is just 7 years from now, so we need to continue pushing forward and reminding us about partnership. And I mentioned some of the partners, but there are others present, like Carter Center, the UN Foundation, the M Fund, they're all here. So showing their interest and the commitment to work with us and with the countries, in support of the countries, because at the end of the day, the credit is the countries. They are the one eliminating diseases. So important that this is a team effort. And now, talking about the countries, let's hear from the countries. They are the main actor here. So we are around the table, and we are in the main course, which is our ministers and representatives from the countries. Let me just introduce Dr. Fernanda Dockhorn from the National TB Program of the Ministry of Health of Brazil. Dr. Rob Dotcom is presenting, did I say it right, Dotcom? Yeah, is representing the Honorable Minister Nícia Trindade, that couldn't be with us. Dr. Fernanda, please, the micro is yours.
Thank you. Obrigada. Então,
I'm grateful to Pajo and the director, Dr. Jarbas, for inviting us to share with you the Brazilian experience. It's an honor to be here representing the Ministry of Health on behalf of our minister, who unfortunately was unable to attend. So let me talk about the Interministerial Council to eliminate TB and other diseases. This is a government initiative of our president. He issued in April of this year a presidential decree with 9 ministries, including the Ministry of Health, focusing on some diseases that are socially determined and also they are a factor in poverty. There are a number of ministries on this council, and it's organized under the aegis of the Ministry of Health. We have the support of civil workers to have intersectoral activities with strong participation by civil society, focusing on some sequences, and I'll be showing you the details. Despite only having 9 ministries, some of the ministries were also invited to participate in SIEDs, such as the Minister of Women, of the Environment, of Cities. The idea was for it to be a strong intersectoral activity, to have environmental sanitation and other specific activities for the elimination of diseases. It is directly related to the 2030 agenda of the SDGs, which is elimination of malaria, tuberculosis, and other neglected tropical diseases. And what social determinants are we focusing on? These are socially determined diseases. They're directly linked to basic sanitation, living conditions, and even access to nutrition, appropriate education, and health services. All of these diseases will be worked on intersectorally through all of these ministries. Our priority is tuberculosis, but also HIV, hepatitis, and all these diseases with vertical transmission, such as Chagas, syphilis, and hepatitis B. And some of them we aim to eliminate by 2030. And tuberculosis and HIV will be following the goals set by WHO. Hopefully, we'll be able to eliminate a lot by 2030. And having less, in Hanseníasis, we want a prevalence of less than 1 case per 10,000 and different levels for other diseases. Although this SCIEDS was created in April, it has a number of focal points from each ministry. It has a name now, and people know where it's going to be active because it's present in most municipalities in Brazil, and the people will work directly and locally. A number of meetings have been held. A working group was established, and with each ministry there is a work plan in place now. Some ministries, such as social development, are involved in all, as well as social protection. They are tied to all the diseases, but other ministries might focus on specifics such as racial discrimination, or maybe focusing on human rights or on indigenous peoples. And that way they'll work directly with the indigenous villages, which are very specific and have difficulty accessing health services. There will be some direct actions in prisons also, where there is also the problem of accessing health services. So you can imagine it will be working with 14 diseases through 9 ministries, but the plan is being implemented, and it is one of the government's priorities. We are working for the health sector. The Ministry of Health has all its responsibilities, joint work between surveillance, and Ministry of Science and Technology, and the CIEDS will focus on intersectoral work, working in research and innovation with the Ministry of Science and Technology, combating LGBT phobia and structural racism, focusing on the equity for the indigenous peoples, working specifically with people deprived of their freedom. We're using new technologies for treatment, but also different means to access the population and provide education. It might be sexual and reproductive disease in order to avoid transmission of diseases such as HIV, and working with specific populations such as the street population. This is a population that's difficult to access and difficult to work with, but there will also be citizen network. So CIEDS will be with a council. The committee will work focusing on inequities throughout the country. Thank you very much for your attention.
Muito obrigado.
Thank you very much, Dr. Fernanda. We're very grateful to you.
A presidential decree from President Lula bringing all the sectors. So this is what is political commitment. Committed to eliminate 14 diseases or more in Brazil. And let us not forget that the World Health Assembly brought us a resolution on indigenous population that was steered by Brazil also, because many of the indigenous and people living in situations of vulnerability are the ones dealing with many of these diseases. So thank you very much. Now, it is my pleasure to introduce the Honorable Sir Molwyn Joseph, Minister of Health, Wellness and Environment, Antigua and Barbuda. Minister Joseph will tell us about how his country is accelerating actions for the elimination of cervical cancer. Minister, pleasure to have you.
Thank you. Good afternoon. Let me first of all express my appreciation for Dr. Barbosa's leadership on this issue, extremely important issue facing the Americas. Acceleration actions for the elimination of cervical cancer, the Antigua and Barbuda experience. The data show that in Antigua and Barbuda, cervical cancer is the second most cancer and the third leading cause of death from cancer in women. Most of the women diagnosed with cervical cancer in 2016 to 2021 had advanced stage disease. We are aware that cervical cancer is preventable and curable through 3 steps. 1, HPV vaccine, 2, cervical screening, and 3, early identification and treatment of precancerous disease and early-stage cervical cancer. Accordingly, the Ministry of Health in Antigua and Barbuda decided to implement the WHO's global strategy to eliminate cervical cancer as a public health problem. Antigua and Barbuda established a National Cervical Cancer Task Force to oversee the implementation of the WHO strategy for the elimination of cervical cancer through the achievement of the following targets by 2030. These targets are 90% of girls fully vaccinated with HPV vaccine by age 15 years. 2, 70% of women are screened with a high-performance test by 35 years of age and again by 45 years of age. And 3, 90% of women identified with cervical disease receive treatment. In terms of vaccination, in 2018, HPV vaccination was introduced in the National Immunization Program. It was voluntary and available through clinics. Vaccines were procured through the PAHO Revolving Fund. The quadrivalent HPV vaccine, Gardasil, was introduced with a primary target population of boys and girls aged 9 through 14. Robust and intense public health sensitization with stakeholders was done prior to its introduction. 13.5% of girls in the primary age group received at least one dose between 2018 and 2021. 88% of this vaccination occurred between 2018 and 2019 prior to the COVID-19 pandemic. I should state that vaccine hesitancy due to the COVID-19 pandemic significantly impacted uptake. Let us look at screening. Up to June 2021, less than 50% of eligible women aged 21 to 65 in Antigua and Barbuda were being screened, with only about 13% of pap smears being done in the primary healthcare system. Only 13%. Accordingly, in June 2021, the Ministry of Health of Antigua and Barbuda requested technical assistance to introduce and implement HPV testing in the country to align itself with the second pillar of the elimination strategy. To provide such assistance, PAHO formally partnered with Basic Health International, BHI, and let me take the opportunity to commend them for their effectiveness in Antigua and Barbuda, a non-state actor with experience in HPV test implementation in the region, to develop and deliver training based on PAHO WHO guidance on introducing HPV testing in cervical cancer screening programs and provide technical support for the cervical cancer screening pilot implementation. In September 2021, Antigua and Barbuda requested support to procure and provide approximately 1,500 HPV tests, as well as consumables and a gene expert machine to support the introduction of this screening technology. PAHO was able to fulfill the request, and with the support of BHI, delivered a training program to start the implementation of HPV screening. The training program focused on planning, implementation, and monitoring and scaling for the cervical cancer screening program. The training involved healthcare workers, laboratory staff, and health services managers. More than 100 persons were trained in 5 two-hour Zoom virtual sessions from March to May 2022. This training in Antigua and Barbuda, March to May 2022, was the first of its kind in the region to apply the PAHO WHO guidance documents to initiate HPV testing in a national screening program. Between September 2022 and January 2023, Antigua and Barbuda piloted HPV screening in the primary care system through designated health centers. 1,569 women were screened, superseding the 1,500 target. In May 2023, colposcopy training was requested to encourage a standardized approach to cervical pre-cancer care, which is a key component of the WHO third elimination objective. This training was a collaboration between PAHO, BHI, the International Gynecological Cancer Society, and the MD Anderson Cancer Center. Laboratory training on HPV testing quality assurance was also requested and done through PAHO with the support of Professor Alejandra Picconi from the HPV LabNet in Argentina. The HPV pilot program saw a doubling of the number of women screened in the primary care system per year over a 4-month period. What were the findings from HPV pilot program? 21% high-risk HPV positivity rate. Let me repeat this. 21% high-risk HPV positive rate. This is similar to reports in research done in other Caribbean countries. And let me comment that as a minister, when I saw this report, I said, this is a frontier that we really had to confront. 5.6% cervical precancer rate for high-grade lesions. This was twofold higher than expected and was mainly due to a high prevalence of CIN2. This led to a 4-fold increase in colposcopy service demand. With a 6-month cutoff after screening, 69% of women were followed up and 67% of women with high-grade lesions were treated. At this point, I can tell you 59 women were protected from developing cervical cancer. Had it not been for the program, these women would not have been identified. There was a higher than expected rate of cervical cancer amongst women screened, with 4 women identified. 3 of the women had stage 1 cancer and were able to have surgery done locally. 1 woman was stage 2 and required chemoradiation for cure. 100% of the women with cancer were treated. What are the challenges? Insufficient HPV vaccination knowledge and awareness in society. HPV vaccine hesitancy. We did not use existing population databases to actively invite eligible women. Insufficient capacity and resources in cytology and colposcopy to meet the increased need. Insufficient quality assurance for histopathology services. We then now turn to the next steps. In Antigua and Barbuda, we see the development of a national strategy and guidelines based on the result of the HPV screening pilot project. This will include the development of systems to support monitoring and evaluation of the program, such as utilization of district health information systems. Scale up of HPV screening program with special emphasis on high-risk groups, such as women living with HIV. Development of programs geared towards increasing HPV vaccine uptake through community engagement and activities geared toward improving health literacy. Consider the use of single-dose HPV vaccination to increase uptake and ensure complete vaccination. Building capacity in health system through continuous training of healthcare workers, investment in technology that will strengthen health information systems and healthcare delivery. Establishment of a local gynecological oncology service. Ensure the sustainability of the cervical cancer elimination program through the continued procurement of HPV vaccines through the PAHO Revolving Fund and HPV tests through PAHO's Strategic Fund. My conclusions. The evidence is clear that when there are limited resources, the use of cost-effective intervention can have significant positive impact on health outcomes and inevitably reduce the burden of the healthcare system. Antigua and Barbuda has led the Caribbean region in being the first country to be part of the training based on the WHO's manual for the implementation of HPV testing, as well as becoming the first country procuring HPV tests through PAHO's Strategic Fund. These actions reflect the strong political will, commitment, and vision to lead the region towards the elimination of cervical cancer. We are confident Antigua and Barbuda will be the first country in the Caribbean region to reach the 90-70-90 goals to accelerate the elimination of cervical cancer as a public health problem. Antigua and Barbuda takes the opportunity to encourage us all to commit or have a renewed commitment to the call to action to eliminate cervical cancer as a global public health. And I say thank you, Dr. Barbosa, for your vision and at this very early stage of your tenure. Thank you to PAHO as well.
Well, you heard it, great progress, but challenges also, and next steps. So Antigua and Barbuda has it all. So, they are going to make it. Congratulations, Minister, because you're right. Excellent political commitment. So the partners, you heard that, and it is important to note that the job is not yet finished. So we need to continue working, furthering and supporting not only Antigua and Barbuda, but all the countries of the region, because cervical cancer can be eliminated. We can do it. Thank you, Minister, again. Ahora, tengo el tremendo placer de...
And now I have the honor of introducing Honorable Karina Randall, Health Minister of Uruguay, who will talk to us about other diseases to be eliminated, to reach the persons that have not been vaccinated through digital tools and geolocation in English. So this is another innovative initiative that we're going to hear from Minister Randolph. Minister, you have the microphone. Thank you. Thank you, and thank you very much to all of you. My presentation is a little long, so I can tell you that you can ask for it, because some of the slides I'm going to show a little quickly, but we do have a file on Word for those of you who may be interested in going into greater details. What we want to say is that to have a georeferencing tool for an integrated vaccine system for immunization would somehow allow us to reduce contagion of communicable diseases. And I think this is what I'm going to try to show you in this presentation. The vaccine information system in Uruguay seeks to optimize the national vaccine register administered throughout the national territory. And it has diverse information sources. The main source of information is the database of the National Civil Identification Direction that has all the inhabitants registered. And in this way, we're able to have universal access. With this database, we will have all the inhabitants of the country. We will have the registration of all the vaccine platforms, COVID, the annual immunization plan, and furthermore, with the advantage that it gives you access to the clinical history at any point, wherever you are in the country, avoiding the vaccination carnets or cards that you give printed and are usually lost. So we have a chance to obtain the vaccine card from anywhere in the country. And of course, the statistical analysis whereby we can have these systems. The application was developed based on the Java system, which is very simple. And what's important is that 100% of these vaccinations have it implemented. So the whole country is covered implementing this system. And this database can load it with the vaccine people, the people who vaccinate, and they are the ones who upload the data. So this is supervised by the anti-tuberculosis system, which is under the Public Health Ministry. And this is the legal framework for the protection of data and the reserve of personal data. And here on this slide, we're simply showing you that aside from the vaccine information system registered by the vaccine experts, we have another data source from which we also take some data. And we can stratify the vaccines into the geographic population level, the age group, comorbidities, all of that can be input in the data. And it serves also as a data supply for other databases and other information systems. I'm just going to give you the example of the one you see down below, which is the coronavirus UY. with the information system. You send the data from this coronavirus UI, and with all the data, they have the coronavirus data on our cell phones, thanks to this georeferencing system. So the identification of the coverage gaps are going to allow us to make health decisions everywhere based on data and in real time. Because we have optimized the vaccine planning throughout the territory, we can identify where they're not covering correctly, and we can strengthen the efforts in that area where vaccines are required or have not reached, where there's incidence that is lower than the rest of the country. And I show you 3 examples here that I'm going to show you very quickly, just so that you have an idea how the system works. One is the scope, the coverage scope in the community with SARS-CoV-2, which was the first time we used this georeferencing system to locate where in the country there was less coverage. The second is the low vaccine coverage zones for the EPI. This is the triple vaccination, and then the georeferencing system with the HPV vaccine. Initially, the georeferencing coverage with COVID-19 between June and December of 2021, when there was a disassociation between the vaccine curve, which is the one you see at the top, and the number of COVID cases, we tried to understand to see if there was some area in the population that was not vaccinated yet. And what we did was do a georeferencing through the system, and the green dots that you see are those that have more than 80% vaccine coverage, more than 70%, and you identified the yellow and red dots, which is where we have a lower vaccine coverage. And through the department directors, the public health ministries in the territory, Uruguay has 19 territories, and each one has their own department director. Each one of these department directors, when they saw the red dots, would organize vaccine campaigns town by town and would go to vaccinate precisely those areas that had the red dots. And here we can stratify first, second, third, or fourth doses, or fifth doses. This is the vaccine coverage of the annual immunization plan. And we chose one of the vaccines here. Here we have all the vaccines that have been offered from 2018 to 2022. And if you notice, I just wanted to see if I could use my pointer. But here what we did was that it was decided that the triple viral vaccine would be the one that would represent, because it's the most representative and sensitive of the vaccination plan and card, to see if it was complete. So we used that vaccine, and that is georeferenced, which is the most sensitive vaccine for the annual vaccination plan. And we identify the same, the red dots where there's less vaccination, under 80% of the children under the age of 5. And in that way, we were able to identify some sites like here. You can see it's that long bar, which is called Canelones. This is an area where there's very low vaccination coverage. So what we do is that we first reference the vaccination centers where they're vaccinated, and then we do georeferencing of the places where the vaccination is very low. Once we put the two maps together, we see if there are differences between the times during which the vaccination center is open. Maybe it's not the right time. Maybe there's no transportation to the sites. So we can identify why they're having difficulty in getting the vaccination, having the vaccination center and the percent vaccine. And from that, we can design a plan. And what we did was to design a plan that would cover those areas in the country that were lower in coverage, which is the vision of the whole vaccination plan. And in 2022, we were able to increase the vaccination level to the pre-pandemic levels. And lastly, I'm going to show you what's now being done, which is the georeferencing of the HPV to achieve the 90-70-90 objective. And in green, we see that it's the 19, which is the highest. The dark red are the ones that have the least vaccination. And this is first and second dose of women, first and second dose of men, to attack those departments that need the vaccinations the most. To conclude, With this project, the georeferencing of vaccines gives greater transparency and trust as to what's being done. It's public. It allows for coordination and collaboration between the central government, the Public Health Ministry, and the department governments to locally promote vaccination where needed and avoid transmission of the diseases in those places. A timely response to health emergencies like we had with COVID-19, we were able to act specifically in those places where there was low vaccination for COVID-19. And with all this data, we are able to make the right decisions regarding health policies. That's why we think that this system of georeferencing vaccinations is so vital for the control of communicable diseases. Thank you very much.
Excellent. Señora Ministra, felicidades,
Madam Minister, thank you very much. Congratulations. That's an example of an innovative strategy, because we can't just wait for the people who are not vaccinated to come to us. We have to go out and look for them. We have to find them proactively so that we can reach health for all, which is what we're looking for, welfare for all, universal health. And Dr. Jarvas has been talking a lot about this, of the need to use innovative tools like the georeferencing tools, which is also used in lymphatic filariasis, And we've heard from the countries.
some of the other actors. You know, we're going to hear about the revolving funds, the two funds, and we're going to hear from also, this is from the Executive Director of UNITAID, Philippe Duneton, who is here, and also from Ms. Magdalena Robert, Deputy Director, Program Advocacy and Communication from the Bill and Melinda Gates Foundation. So these are short interventions. Let me start with our own Santiago Cornejo, who is the Executive Manager of the Regional Revolving Funds of the Pan American Health Organization. Santiago, the floor is yours.
Thank you, Marcos. As Dr. Barbosa mentioned at the beginning, the Revolving Fund for Access for Vaccines, as well as the Strategic Fund for Essential Medicines, are working together under the Regional Revolving Funds. Working together helps us to adapt better to country needs based on epidemiological and programmatic criteria, analyzing historical trends on performance and needs, and optimizing financial processes. Already, the Honorable Minister of Antigua and Barbuda talked about cervical cancer and the great example that it is of the benefit of the both funds working together. With our 4 goals in consideration, we will be looking for new approaches to overcome country and sub-regional needs like the Caribbean, providing technical cooperation in a holistic approach for cross-cutting issues such as supply chain and forecasting, and conveying a unifying message around regional solidarity and regional manufacturing. Massimo already talked about the benefits and the role of the regional revolving funds in the elimination agenda. One, very important, accessible portfolios. Our portfolios comprise of cost-effective interventions and products like vaccines and generics for hepatitis C and malaria, and HIV. Hard-to-acquire medicines like malaria medicines that are not found available in local markets. Also, we use pool procurement for more affordable prices, but also of great benefits for smaller quantity treatments, as well as new technologies that are available now in diagnostics, vaccines, and treatment. But our pool procurement, our portfolio is based also on a foundation of mutual support. It's the technical cooperation of the Pan American Health Organization, as well as us facilitating horizontal cooperation of countries to share lessons learned as well as best practices. Also, we have a donation program for Chagas, for NFX, that is only acquired through this donation program, as well as an emergency stockpile in the Pajo warehouse that allow us to provide access for malaria and pediatric antiretrovirals, TB, and HIV diagnosis in low quantities in emergencies. All of this to help for the prevention agenda that will create great savings in the future. Now, we have many examples, but I would like to focus only on two due to the time of the benefits of the regional revolving funds. Let me talk about hepatitis C. We have been working with a few member states to reduce the price of generics of hepatitis C. And we see here the generic fixed dose combination being reduced from $9,000 to $72 plus $1 for the diagnosis. This is an over 90% reduction that we have been able to accomplish together. But also we have been working with other member states where due to patents cannot use generics. And also you can see the benefit of working together and a reduction from $7,800 to half of the cost of $3,400. We believe that this is a great opportunity for all member states to have access to hepatitis C treatment. Furthermore, if we work together and we consolidate additional demand, we can have further reduction in prices. Another example on HIV treatment. Also, this has been quite successful, what we have been able to do working with 25 member states to have strategic partnerships to consolidate global demand and improve access. And we can see how treatment has been reduced by the cost by 50%. Like treatment, we believe there is an opportunity to work together to consolidate your demand for diagnostic kits and tests like HIV self-testing. Let me finish. I only presented two examples, and there are many other examples. But what is more important is that there is a unique opportunity for our region to work together to create more success stories if we can consolidate through the funds your demand of key products on the elimination agenda. This is our call to action today. The regional revolving funds are ready to support you to provide technical cooperation from the beginning until the products arrive, for planning and characterization to ensure that your forecast is accurate and timely, and more important, to ensure quality products. And we are leveraging technology for you to have access to information at the right time in order to make decisions, and you can always leverage our credit line to make access faster. Thank you very much, and I would like to invite you all to participate in our regional revolving funds to improve access together and to address disease elimination initiative together, and please visit our booth outside of the forum. Thank you.
Thank you, Santiago, and I challenge you to think about any other cheaper price for Hep C. There you go. And Minister Franke, who has been championing the strategic fund, said very eloquently at the COSOP meeting that these medicines are available through the strategic fund. So please, demand consolidation. It's important. Work with your strategic fund and your revolving fund for vaccines. Thank you. Now, without further ado, I'm pleased to introduce Philippe Duneton, good friend from Executive Director of UNITAID. He's going to talk more about innovation and touch bases on UNITAID portfolio and the way forward. Thank you very much for being here, Philippe.
Thank you, Marco. Thank you, Marco. Director Barbosa, Minister, dear colleagues and friends. Buenas tardes. Good afternoon. I'm really inspired to be with you today because what we do, innovation, and we talk about elimination, deserve political leadership. And I can see the political leadership of the director, of the minister, of the countries, and I think it's really needed, but I can see the moment after the COVID fatigue that now it's time to fight back, and I think that it's absolutely good. UNITAID is about the P, the political leadership, the product introduction, innovation, and scale up. It's about the people, and I think that the program of elimination, and we discussed with Dr. Barbosa, needs to focus on people-centered intervention and approach. One of the challenges of elimination is the fact that the people, the poor people, vulnerable people are quite difficult to reach. And if you give them the right tool, in fact, they use it. And we have many examples for auto-test, self-collection, for example, for cervical cancer, that make a dramatic difference in terms of reaching the people in need. And it's really a lesson. We have many examples of that, and I'm sure our colleagues here have the same. I need to click somewhere. There. To make it very short, yes, United has an impact. We saw the impact through the, of course, the life aid and the public health, and it's more than, it's a typo, it's 200 million people that benefit from what we do in introduction of innovation. Money is important, of course, is 8 billion saving. We mentioned the importance of the price of the medicine and innovation. And of course, the time. What is important in innovation, it's the acceleration of the response. And we have measured that. And for the 3 diseases, HIV, TB, and malaria, in fact, innovation that we bring accelerate to reach the goal by more than 3 years, which I think it's a real benefit. I've learned a new terminology today, which is good, is PMTCTE. Is it correct? So it's what we call, on the other side of the Atlantic, triple elimination. As you know, it's absolutely key. One thing about elimination is not, as you know very well, a long list of disease. If you look at people, people have different challenges in health. And in fact, it's the consolidation. So I think behind the PMTCT plus or triple elimination, and we will launch a call in the coming weeks, it's really to take care of the woman and the child, not only for HIV, not only for hepatitis, but also for EST, in particular syphilis. This is really absolutely key in the agenda of elimination. We have some experience working with several countries here, in particular Brazil and others, in terms of Chagas, which is, as you know, a dimension also through the women's health. And we are also, dear colleague, very excited with the decision of Brazil for elimination of TB. We have a lot of tools that can contribute to that, but of course, tools without political will and right programmatic intention and implementation is nothing. Just to mention, it's a very busy slide, that we are really still focused on HIV, TB, malaria. You will have the slide. But really, more and more, we are focused on women and children. As I mentioned, the PMTCT plus intervention, and still a lot of you have fatigue of COVID-19, and I don't know if we are in a post-pandemic, pre-pandemic, or inter-pandemic, but yes, we are also involved in the response. Again, triple elimination is really something that we want to put on the agenda. I am really pleased and thrilled to see that on this agenda of elimination, we may have things to do in common. I think the presentation of our colleagues from the Strategic and Revolving Fund is really inspiring, because we have been quite cousins or brothers working together on several issues. And so I think that there are, if you look at the pipeline, some good technology, in particular in testing for simplification, that will be more affordable, even compared to GeneXpert, even if we have some progress in that way. But we need really a tool that is more simple, multi-disease, and we had that kind of technology is coming, and we are looking for a negotiating of price. Anyway, accelerate progress will be really to look at the barriers that are in front of us, that are multiple, of course, But by experience, again, there is no barriers that cannot be overcome in terms of new innovation, in terms of price, in terms of quality. It's something that we have a track record to address. And again, I think that with that kind of vision and commitment you have in this region, I think it's very encouraging, and we're looking forward to work closely with you and, of course, our colleague from the Strategic Fund. Thank you.
Thank you, Philippe, and welcome to the Americas to further more the collaboration, not only for Chile and Brazil, but for other countries of the region. They are sitting here, so please feel free to talk to Philippe after we finish, and because I think the future is very bright for this initiative if we work together. Last but not least, we're going to hear from the Bill and Melinda Gates Foundation, from Ms. Magdalena Robert, Deputy Director of Program Advocacy and Communications, Polio and Vaccine Delivery. And Magdalena will tell us about the commitment of the Bill and Melinda Gates Foundation on cervical cancer elimination. Magdalena, please, the floor is yours.
Thank you so much. Honorable ministers, colleagues, Director sorry. Is it working now? Honorable ministers, Director Barboso, amigos, colegas. En nombre de la Fundación Bill and Melinda Gates, es un placer estar aquí con ustedes.
It is a pleasure to be here with you.
Where every person has the opportunity to have a healthy life and a productive life. We do this by spurring innovation, by strengthening global cooperation, and working with local partners and governments to make sure that the innovations that we believe in actually reach people. We have been working very closely with WHO over many years, and our partnership is now several years old. And this is very representative of the importance that WHO plays in making sure that people have healthy lives and better futures. Our engagement of PAHO has been very targeted. And I'm happy to say that we were one of the early supporters for the Vaccine Revolving Fund that Santiago is now leading. We have also shown support in small and targeted health initiatives, and we hope that this partnership will continue. All of the diseases that we are discussing today and this week in DC are of critical importance, but I'd like to address one of them that requires our urgent attention. When we talk about eradication, you usually hear the Gates Foundation talk about polio. When it's about elimination, you also hear it talk about malaria. Today, I want to talk to you about our work on cervical cancer. We know the statistics. We know that globally, there are 340,000 cervical cancer deaths every year. 340,000. Making this one of the most common cancers among women worldwide. And 90% of the cervical cancer deaths happen in low and middle income countries. Unfortunately, Latin America and the Caribbean have the second highest cervical cancer incidence mortality after sub-Saharan Africa. This is, my friends, simply unacceptable. We have the tools to prevent, we have the tools to diagnose, we have the tools to treat cervical cancer. And when WHO member states have agreed that the global strategy in 2020 that calls for the acceleration and action of these three pillars, we need to make sure they are implemented and not just words. As the minister already shared with us, our targets are 90% of the girls need to be fully vaccinated, 70% of the women need to be screened, and 90% of the women should be pre-cancer are treated. That is 90, 70, 90. Unfortunately, the world, including the Americas, are not on track to meet the WHO cervical cancer elimination targets by 2030. But we've been here before, and we know that we can accelerate progress. And on the vaccination target, I am sorry to say that the average shows only 10% of the girls in low and middle income countries have access to this vaccine. 15 years ago, approximately, PAHO made the recommendation for 3 doses of this vaccine. Then it was 2 doses. And thank you to the Right Act, we now know we only need 1 dose. So please, please help us implement this. The one good thing is that PAHO is, as always, ahead of other regions when it comes to immunization, as well as your recommendations. So we know that 11 countries out of 47 countries, many of these in the Americas, nearly a quarter have already committed to a single-dose schedule. Minister, congratulations for your plan in Antigua and Barbuda. Also, congratulations to Bolivia, Guatemala, Guyana, Jamaica, Mexico, Montserrat, Peru, Santa Lucia, Turks, and many of you that are going to be making the switch. We also heard from the Minister of Colombia that soon they will be doing one-dose vaccination for boys and girls today. So just letting you on the secret, but it's amazing. So we do want to make sure that we do not continue to have this inequity of issues. We want to ensure that HPV vaccination is an intervention that requires cross-sectoral collaboration among the immunization sector, the child health sector, the adolescent, HIV, cancer, sexual and reproductive health, and education. We believe that technical partners like WHO, like UNICEF, Gavi, Global Fund, Unity, many of those that we fund are crucial in the fight against cervical cancer elimination. We cannot let another generation of girls not get this vaccine, or women have to struggle with this disease. We know that we have the tools, and therefore we have seen some exciting momentum on the fight against cervical cancer. At this year's World Health Assembly, there was a launch by health professionals and advocates around the world for a global declaration to eliminate cervical cancer. We have over 136 countries that have called for this, many thousands of people calling for action. And then let me just conclude to say that the Gates Foundation is fully committed to help low and middle income countries to build stronger, sustainable immunization programs on cervical cancer to ensure the HPV vaccine reaches girls who need them the most. We are working with country leaders, partners to accelerate progress and make sure other life-saving vaccines also reach those that need it the most. I am confident that working together we can do this, and I look forward to partnering with PAHO, with Unitate, Gavi, and other partners to host in the Americas a cervical cancer event in Q1 of 2024. Together we can do this, and I thank you very much for your support and partnership.
Thank you, Magdalena, and thank you to the Foundation for supporting PAHO and the countries of the America and for that global event that is going to take place next year in Q1 in the region. So this is supposed to last until 2 o'clock, but we're going to get a few more minutes. I'm going to open 5 minutes only if there is any burning comment or intervention to make. And I see the Honorable Minister of Argentina. Please, if we can have it short and brief so we can have opportunity for 2 or 3 more. Thank you, Honorable Minister.
Thank you very much. Very, very brief. I want to celebrate and congratulate you for this initiative. After having heard all the presentations, I think that this is what we need. We have the tools already, but we need to focus on access and to have intersectorality in this so that we can turn this into a reality. The commitment needs to come not only from the ministries, but it has to go beyond health ministries. There has to be political support from other ministries, as we had during COVID with mental health, and it has to come from the community too. It has to be grassroots, and there needs to be good communication, and we need to approach stigma and discrimination for these diseases, and this is sometimes a barrier to access. Congratulations, and please count on me.
I don't see more hands, but meaning that you were satisfied with all the interventions and the good prospects of advancing elimination of communicable diseases and related conditions in the Americas. So now we're going to go to the landmark finish, which is a recognition to a country that has been recently certified as eliminating malaria in our region. also has been certified for EMTCT, and we are expecting the final confirmation soon. So let me just pass the micro to Dr. Barbosa for the recognition of Belize.
Thank you, Marcos. Dear Honorable Minister Kevin Bernard, this certificate is a recognition of Belize's determination to eliminate the transmission of malaria. It's an honor for me to congratulate you again, your country, your government, the Ministry of Health and Wellness, and the National Vector Control Program for its leadership, determination, and the commitment to pursue and finally achieve the elimination of malaria. I must also extend my congratulations to the health personnel who for decades dedicated their work to eliminating this disease, and the community health workers, voluntary collaborators, and other actors engaged in the fight against malaria. This is an extraordinary achievement for Belize, and it will serve as inspiration for the other endemic countries in the Americas. Congratulations.
Thank you very much, Dr. Barbosa, esteemed director, my colleagues on the head table, ministers. It is with immense pride and a deep sense of gratitude that I stand here before you today representing Belize as we receive this official certification from the WHO PAHO organization, declaring our beloved nation as malaria-free. This is a momentous day for Belize, a culmination of a long, hard-fought battle that spans almost 7 decades. Our journey began in 1957 with the global malaria eradication efforts. It was a daunting task, but the courage and resilience of our people and the dedication of our healthcare workers have been unwavering. From the peak of 10,411 cases in 1994, we have fought back with the last local case reported in December 2018, marking the end of this debilitating disease in our land. This achievement is testament to the strategic investments we have made, targeting vulnerable population groups and the unwavering support of our local and international partners. We are grateful to the Global Fund for supporting the elimination of malaria in Mesoamerica and the Island of Hispaniola initiative in 2014, and the Inter-American Development Bank and other partners for initiating the Regional Malaria Elimination Initiative. The World Health Organization's inclusion of Belize in the E2020 initiative in 2017 provided us with the technical support and guidance we needed to eliminate the disease and prepare for certification. We have been guided by a robust strategy underpinned by strong surveillance systems, free diagnostic tests and supervised treatment, and effective vector control methods. Our fight did not stop with the elimination of malaria. We knew that the fight was far from over, and we had to prevent the re-establishment of the disease. The Ministry of Health and Wellness, with the support of the Pan American Health Organization and the Inter-American Development Bank, developed the National Strategic Plan for the Prevention of Malaria Re-establishment 2023-2027. This plan builds on the success of our previous plan, focusing on strengthening diagnosis, treatment, investigation, and response. Even when faced with the global COVID pandemic, we did not falter. We integrated our vector control program with the COVID-19 surveillance system, introducing rapid diagnostic testing and vastly expanding our diagnostic network at the community level. This achievement is a testament to our commitment towards achieving the Sustainable Development Goals. We are proud to be contributing to Target 3.3, which calls for ending malaria worldwide by 2030. None of this would have been possible without the ongoing grassroots community support and our dedicated healthcare workers, the cornerstone of our success. I extend our deepest appreciation to the Pan American Health Organization, a long-standing technical partner, and the many entities involved in the regional malaria elimination effort, including the IADB, the Bill and Melinda Gates Foundation, the Carlos Slim Foundation, the U.S. Agency for International Development, and the Global Fund. Our success in eliminating malaria is a testament to the dedication of our healthcare workers and the resilience of our people. It is also a testament to the technical cooperation and financial contributions from all our partners. Malaria is preventable and treatable. Let us continue to strive towards the elimination of all vector-borne diseases. Together we can make a difference. Together we can create a healthier, safer world for all. I thank you very much.
Thank you, Minister. It can be done. There you go. You have the example. So this concludes the proceedings of this briefing. We thank you all, and we wish you good afternoon at the Directing Council, because you cannot go home yet. So thank you all. Thank you.